Hi everyone, you're listening to CMHA Windsor-Essex branch Keep Connected podcast. This podcast truly is all about mental health and creating and learning and listening to individuals with lived experience. In my personal view, who better to hear messages of hope, resiliency, and really how we gain strength and keep on going. So thank you for listening in. Today I have a really special guest, and I guess I'm a little nervous about that. I have met Tina about 3 to 4 years ago when I first started in mental health education. And what can I say about Tina Szymczak? She is honestly a mental health advocate. You truly embody everything that I would like to be when it comes to being an advocate, having such an amazing voice through your blog, through your speech, through everything you say about all the things that we can do better at in our system right now when it comes to mental health. So yeah, I'm a little emotional today because you are awesome. So Evelina, that is where I'm at today.
Mm-hmm.
So we have Tina Szymczak and my wonderful colleague Evelina.
Yes, and Tina, thank you so much for being here. I really, really appreciate it. I can't wait to kind of dive into the conversation about, and one of the reasons I wanted you to have you as a guest is because of your blog and a recent post you did about suicide strategies and how Canada basically is lacking a suicide prevention strategy overall. And just wanted to mention the reason I'm wearing this T-shirt, the "You Are Not Alone" T-shirt, is that CMHA every September, and you've been involved with that all the time. Every year is Suicide Prevention Month. So I guess I'll just start with, how did you get involved with being someone who speaks out about, and advocate for mental health? What was it that you felt like you wanted to do or change, or what were the messages at first that you wanted to get out there that were lacking kind of, in the media or in the conversation?
Well, I thank you for having me here. I think in the beginning, I was an advocate for my sons who both have disabilities. And as they grew older and my own mental health struggles grew, I had some hospitalizations, and it was through those hospitalizations that I really realized the inequity in our systems. I was lucky enough, I had some funding, extended health coverage to be able to go and see a psychiatrist and a psychologist, whereas other people who don't have those things didn't get those kinds of services and fell through the cracks. And my experiences in being in the hospital, I eventually wrote a letter. It took me a couple of years to get to the point where I could write the letter, but I wrote a letter to the hospitals expressing my concerns for the way that they are run and the things that happen to people when they're there. And that was kind of my start into the foray of mental health awareness and advocacy. And then CMHA reached out. And actually, I had gone to the ASSIST training and met Jenny Lee there. And so when I wrote my letter, I sent her the letter because I wanted it to be seen by as many people as possible.
And it brings me chills. So I know the viewers, I know you listening, you're probably thinking, ooh, I want to see this letter. Well, go to spiritedblessings.com and you will see this letter. You were such a phenomenal writer, but the reason it gives me chills is you described things that in any mental health profession, anybody who is a helper in a helping field, we see things that we want to change. We know that should be better, could be better, need to be better, must be better, but they're not. And when I heard your letter and the amount of individuals you forwarded that letter to, I just thought, wow, what amazing courage, because it got sent to very, very high up individuals, because it was almost like, enough. We need to start changing the culture around suicide prevention, around mental illness, and specifically about how we are treating others that are struggling. Because our message is, we want individuals, anybody listening out there, to know you're not alone. But we can't have that message, and then when finally someone does reach out, they feel like they are alone. And I think we really have gone leaps and bounds when it comes to that letter, which is about 3 years ago, right, Tina?
Yeah, I think so.
And since that letter, it just kind of, so basically the letter really discussed, please visit Tina's website. It's a wonderful blog. It's called Spirited Blessings. And Tina, and that's why I asked my friend to come today, is because, and I'm going to pull it out, I am going to read it because I want to get this right. So Canada right now is the only GH country without a national suicide prevention strategy. So why does this even matter? It matters because suicide prevention strategy is essential roadmap. We need a roadmap that we can all utilize in Canada to reduce risk factors for suicide while enhancing those life promoting factors that we always talk about in Assist, and build resilience both on a public and a population level. And I'm going to pull up one stat that I will read from you, and you can please read Tina's full article, because she is going to go and break the National Suicide Prevention Strategy into, let's do this. It's like you're essentially like helping start the process. Let's build this strategy. So what would it mean for Canada to have a national suicide prevention strategy? Well, let's just look at this. So Tina writes that Scotland's strategy that started in 2002, after they adopted a national suicide prevention strategy, achieved an 18% reduction. And I say that really loud because that's huge. Right now, worldwide, every 40 seconds, we are losing someone to suicide. 40 seconds. Right now in Canada, worldwide, they say it's about 4,000, give or take. We know that number does not reflect the correct number out there right now. And that's why I am so passionate. That is why we can't lose any other individuals. We need to have a strategy in place to really, let everybody know that we can reach out for help. It's okay to experience thoughts of suicide, but it's having that help there when you do.
And then systematically having trainings, in place, right? Like, I don't know if when you took the ASSIST training, which is Applied Suicide Intervention Skills Training, in case if you don't know the acronym for that, I'm guessing you might have had to pay for that training, which is not a free training. We've had a lot of wonderful sponsors sponsor us, like Dan James sponsored us to provide it for first responders and families of first responders for free, because we know that population, it's helpful because they're also helpers to others as well. So, but it is an expensive training. And it's, for a lot of people, it's not affordable. So just having those things in place would be helpful in itself to provide it for free. If we don't have a framework or a roadmap that's supported by policy, it's really, really hard to do that, right? So we're all kind of trying our best, and we're having, all this promotion for suicide prevention from the ground up, but it's not from, the top down, at least not in Canada. So any thoughts on why that might be, or what do you think, where should we go from here? And what do you hope to see as well?
Well, I think in some ways people kind of dismiss it. 4,000 people, and we know it's more than 4,000, but that's what gets counted. 4,000 people in Canada die by suicide. Well, if you think of it this way, that's 2 high schools just gone. Would we be okay with that? Would we be okay with Tilbury just being gone? No. So people need to start thinking of it as individual by individual, and what can we do, because it's preventable. That's the thing. It's not a disease that can't be cured. It's something that's preventable. And all we need to do is put things in place. So for example, I took the ASSIST. It was the first time that I ever heard of a safety plan.
that to me struck me. Like, so when we think about a safety plan, most individuals that, in Tina's case, like you said, you were in hospital.
In and out of hospital my whole life. Never ever had anybody talk to me about a safety plan. Then I took a cyst, and there was just a mention of a safety plan, which kind of made me go, oh. And then I did some more research and found safety plans and realized I could do a safety plan with my family and my friends. And when I went down that path again, I was able to reach out to people, and I didn't have to say, you know, because it's hard to actually say, I'm thinking of hurting myself. It's hard to say that. So to be able to just reach out to people, and for me, you know, I have a code word, it's purple. And so I just have to say to people purple, and they know not to leave me alone, that things are not good. And we put the steps in place that we figured out.
Why I'm wearing purple today. And the reason why I get really choked up around Tina is because, I mean, you are such an advocate, but you are really, truly showing how when we create a culture of help, a help-seeking culture filled with hope and tools and resources and education, and you feel supported, you ultimately, you save your own life.
Yeah.
Right? So, and we say that all the time, I am going to help someone save their own lives, because you get to help someone help themselves, and by offering things that maybe they didn't have in their little toolbox of resources.
And I think a lot of people, and especially doing these assist trainings, people are so afraid to say the wrong thing or approach it a certain way. But really, I just wanted to say that being authentic in your own self and just being supportive to that person and listening and hearing them out is huge, right? And just even having and opening up that conversation of, do you think about hurting yourself? Are you thinking about killing yourself? Are you thinking about dying? Have you thought about that? And just allowing them to tell their story and talk about those things is huge. And I think that's really missing, because, you know, we don't talk about death or dying that much. We don't, I mean, especially, I mean, what do you think, how maybe even the pandemic has impacted people, like in terms of feeling lonely or feeling, you know?
I think it's done horrible things to people. And I know in our region that there's been an increase in suicides, but they're not being talked about. They're not being reported on. Because we don't want people to think that there's a problem, and we have to be careful how we report on them. And I understand that there's a limit and a responsibility that we have to not make some sort of hysteria. But at the same time, we need to acknowledge and we need to put resources in place for people that are struggling with being alone. I mean, there's people out there that don't have family and friends, and so when we did the whole, you know, have to stay home, they literally were at home by themselves. And if you have mental health issues, that's not going to be helpful. That's not going to help people stay connected. And we know that staying connected is one of the main ways that people stay healthy.
Yeah. And I'm going to ask you right there. So if you don't mind sharing, and I know it's personal, I totally don't want it. Talk about the purple, color purple, and take it back about what? A year?
Yeah, probably about a year ago. I was going through a rough time. I was at the same time trying to do my safety plan,
like everything.
And things started to kind of go sideways. And, you know, at the time I didn't know I needed an adjustment to my medications. And, you know, so that was something that I was working through. And I was kind of trying to figure out, how can I stay connected? Because when I become depressed, I pull away from everybody, and it's really hard to connect with people when you're feeling that way. But I knew that staying connected was really important. So I kind of tried to figure out what was a way for me to stay connected. And so I decided that I would ask people, and I just did it on Facebook. I just, you know, I'm only friends with people that I know. So I said, you know, this is the situation. I want to have letters that I keep, that I look at when I'm having a down day. It doesn't necessarily mean that I'm suicidal. It just means I'm having a bad day. It could be a letter about how we met. It could be pictures. It could be a poem. It could be something inspirational. It could be anything. Just put it in an envelope and write purple on the back so that I know not to open it unless I really need to. And then I just got myself a purple box and I put all these envelopes in there. And it was funny because people didn't write like on the outside who they were from.
Oh, that's
so I don't know when I open one who it's going to be from. And some of the people are people that I hardly even know. And yet they're saying these wonderful things about me. And I'm like, I had no idea. So I really encourage people, like, ask people to do this for you. You know, pick whatever word you want. It doesn't have to be purple. Pick a word that you want and have them do it. And keep them. And I still have a bunch in a box. I still haven't opened them. I guess you have to be the kind of person that you don't want to open them all at once.
I would totally open all of mine at once. I'd be like...
Well, that's so creative.
Isn't that amazing, though?
And you know, when you're talking about, that's, I mean, some things you wouldn't think of it. Like we're thinking so complex sometimes of like, how do we keep connected? How do we do this? How do we do that? And we make it more complicated than it needs to be sometimes. And just asking, hey, write down something that you know might cheer me up or make me feel better. And asking for help is a big thing too, right? Or asking for someone to do that for you is also, it shows like, you know, the ability to accept help, and it's hard for some of us to be able to do that. But it sounds like you have some great supports, and it sounds like you have a great connection with a lot of people. And I'm guessing a lot of people visit your site and check out your stuff and have been following you for a little bit now, eh?
Yeah, I think so. I don't really keep track. You would think that I would, but I don't really keep track. But the most important to me is that I get my word out there. And if it's one person versus 1,000 people, to me it doesn't matter. As long as it's helping one person, that's all I care about.
Well, I think there's a lot to learn from your blogs and you know, your experiences, because everyone, I feel, can take something out of there, like tools in a toolbox, like something you might have never considered. Something like that was super, super helpful to someone.
To me, I find it adds that therapeutic value to yourself. In, you know, I often say we are our own mental health expert. And you, Tina, by far have gotten to know yourself in and out. And you are at such an amazing point where for you to be able to let your friends on Facebook know, like, hey, I want this. I'm not going to tell you I need it now, or I just want this. And it's all about connections. It's about that human connection, really truly knowing, yeah, I don't feel good right now, but I don't feel alone.
Right.
And I can go grab a card. And it's that drive that keeps. And for those of you listening, if it's, maybe your connection isn't people. It could be journaling. It could be art. It could be your spirituality, your religion, your faith. It honestly doesn't matter. Get to know yourself. Get to know, you know, what drives your core to let you know to keep on going. Tina mentioned, you know, suicide is preventable. And I want to acknowledge that, yes, we can do more as a country, as a society. We can create and build a suicide-safer community. But we can only prevent those suicides from those that we know of. So for any of you that are struggling out there and you are having a hard time reaching out, you know, call a crisis number. Here in Windsor, it's 973-4435. Use Kids Help Phone. Text 686868. Call a friend. Call a pastor, call a coach. I don't care. Call anybody. If you don't want to tell someone that you're not feeling safe, that is okay. Just tell them, this is what I need right now. I just need to be near someone, right? Yeah, we gotta stop. We gotta reduce the numbers, because I just see individuals with such amazing stories of hope and resiliency, and those that have tried to end their lives that are very much still here. And everybody has always said, you don't want to die, you want the pain to go away. And that pain, right, is different than wanting to die. right? So hold on, pain ends. I like your, do you want to tell any listener out there? The semicolon.
Semicolon. It just means the author could have chosen to end the sentence, but instead carried on.
Mm-hmm.
So.
And that is a beautiful symbolism of what we want people to understand, is that choose to go on. And if you feel alone, please reach out. Yeah, that's about it. I mean, for me, this is super emotional for myself, only because, again, we've been in this, about 3-4 years ago, and this year, Suicide Prevention Awareness Month might look a little different, but I think that's why it's so important to have listeners here visit our website, see what events we might be hosting virtually, read up on how you can help someone, know signs of when you might think somebody is not doing so good. And I think my biggest thing, Evelina, you mentioned it, is just be your authentic self. But secondly, don't ever, ever, ever be afraid to ask someone, I'm concerned, are you thinking that life just might not be worth living right now? And that instantly opens up the door, because that person needs you to ask that question. What else do we want to say?
Well, I was going to ask Tina. So since you met Jenny for a few years ago, and since you've started the blog and website, and I read that you're maybe in Chicken Soup for the Soul.
Yes.
Could you talk a little bit about that, and also any tips, like, because you've been, obviously, it's hard to every day is it's a journey. Like, recovery is a journey, so every day is different. I know that, I understand that. So it's like, what sparked up your passions and to do all this stuff, and what are some of the things you're working on now?
Well, one of my passions is writing, so that led to me getting a piece in the new Chicken Soup for Your Soul, Follow Your Dreams book. It's coming out on August 11th, so I have a piece in that. And really, for me, writing is the way that I connect with people. It's the way that I express myself. I feel even keeled when I'm writing. When I don't write, then that's when I really struggle. So I think that, even years ago, before Facebook and all of that, I was on like news groups and things, and doing stuff with advocacy with parents. And so now I've just changed it, and now it's a blog, and now it's Facebook, and doing it through there.
Mm-hmm.
So.
That's wonderful. I'm excited to read that whenever.
I know.
I am.
Tina, you have a wealth of resources and little strategies that you've collected over the years. For anybody listening in, what are some helpful strategies when, in our last podcast, we had Natalie talk, and now I'm always going to use Natalie's term, those garbage days. But what are some strategies that help you through
those bad days?
Yeah.
I think first and foremost, I remind myself that it's just one day, that it will end. A good nap goes a long way. I also have a husband that I've been married to for 25 years. So talking to him often helps, gives me perspective. He's able to put things into perspective for me a lot. If I start going down some path that's kind of dark and, twisted, he's kind of like, it's not quite that bad. So that's good. And I think just getting out, going for walks, being in nature, being with my dog, things like that, just things that ground you so that you're not in your head maybe as much.
And you speak, as you're talking, I'm like, yep. And it's all about that balance. Mm-hmm. And it's really trying to create that equilibrium where you feel like things are in balance. And if they're not, and you have that wobble, it's okay. Because you have so many of those strategies, those go-to things that we're all just trying to keep our equilibrium and keep that balance.
And I think it's just like you mentioned, self-awareness, like just knowing ourselves, and then letting others know what to expect or where we are to, like communicating with our loved ones. And hopefully they communicate with us about where we're at the time and where they're at. And just being open about how we're really feeling and not just saying, oh, I'm good, I'm fine. But really there's something else going on, you know? So.
Well, and I never used to know, like years ago when I was depressed and upset, I honestly didn't know what was upsetting me. Like, so when people would say to me like, oh, you know, is everything okay? You seem, and I'd be like, no, I'm fine. And I'd think like, cause I should be fine because there really shouldn't be anything wrong with me. And it wasn't until, again, I keep saying it, but it wasn't until I did the safety plan where it really breaks it down for you and you look at all the areas of your life and all the steps that you take and all of the goals that you might have and those kinds of things. And you pull it all apart and then you see the parts of you. And then you're able to tell somebody else, you know, what to look for. Oh, you know, when I do this, look for this. When I'm sleeping a lot, I'm trying to escape. So that's probably not a good thing. So you're able to tell somebody those things. Whereas, because people aren't mind readers. And if we don't know ourselves, how can anybody else know us?
Yep. Yeah.
That is so true. Absolutely.
1,000%.
So thank you, Tina, for having a wonderful conversation about us. Again, how are we going to create a national suicide prevention strategy? When are we going to get on this? So here in Windsor-Essex County, we are happy to report that we have here a suicide prevention coalition with various partners all across the community, and we are really, really focused on, you know, that community, that well-being is our sole focus here in Windsor-Essex. And what that means is we are trying to build this suicide safer community with prevention, a lot of awareness. So look for, in the next couple of weeks, again, like we mentioned, Suicide Prevention Awareness Month is the month of September. We most definitely will be doing a lot of events, whether it's virtual, whether they're outdoors. We're just gonna go day by day right now. And we are trying to build that suicide safer community by essentially having these tough conversations about suicide. It's a tough conversation, but we have to have it. Suicide grows in isolation and in darkness. And when we start speaking about it, it really sends a really clear message to everyone out there, is that you're not alone and that there's no stigma, there's no judgment, and we're ready to have an open conversation to help and to get you through things. So, thank you for listening.